We first of all start by talking to you. We ask, where you grew up, how much time did you spend in the sun, what's your family history, what's your family background, so that it's really important to establish the risk factors first. And we also ask medications you're on, because if you're on an immunosuppressant, you are going to be more prone to a skin cancer. So we need to find this information out. That's why I said before we ask who you live with, because is anyone else checking your skin at any point? So it starts with questions, history and questions, and building that rapport. The next thing that we do is, or certainly I do ask to basically undress down to your underwear. Ladies, I understand sometimes get a little more embarrassed, but we do prefer without the bra, but we can work around it and just move as well. It's entirely up to how the patient feels comfortable. I have them sitting on the bed first, and I've got a magnifying lamp, and it's got polarized light, which makes some things show a bit better. And I start by starting at the fingertips, and I work my way up the arm and down the other side, and do the same on the other arm. I often do touch as well, because it's important to use all our senses, and sometimes those early squamous cells, they feel scaly, so it's really important to do that. Especially in a tattoo, I may not see it, but I'll feel it. Then I get the patient to lay down, and they can be offered a modesty blanket, but basically I start from the top of the face all the way down, top of the ears, and I do feel the ears, and I work my way entirely down the body. I personally go side to side, and as long as we do the same with each patient, it doesn't really matter how the doctor does it, but they'll have their own pattern that they use. And then I do the same with the lower limbs, always check the bottom of the feet and in between the toes. And then I ask the patient to flip over, and I do the same again on the back. And at that point is when I check behind the ears, because you can get some skin cancers there. And I also check the hair, which I must say is much easier on gentlemen who have got really short hair. You just run your finger over and it flicks and you can see, but yeah, it's still important that we do check on the scalp, and ladies as well, So basically head to toe, and then at the end, you have the opportunity to get dressed, and we'll discuss anything that I've found. I document it, and I offer some of the treatment options that might be available or suitable for that patient. It's vitally important that we don't wear makeup when we're doing the skin check. I can't see, and some of those, the foundations they've got these days, they cover everything. You've seen them, they cover a tattoo. If they cover a tattoo, they're going to cover the skin cancer, and I can't see it. So it's really important that you come barefaced, and that you don't have any makeup. Whether you put your normal skincare regime, that's fine, and certainly wearing sunscreen doesn't matter. In fact, if you're going to be outside before you come see me, please wear the sunscreen. So that sort of stuff doesn't matter, but you definitely don't wear makeup. Make sure you haven't got anything else on, and obviously wear something that's comfortable.